Atrial infiltration is something that we have ignored for a long time. But when we actually look at the atrial function, we then realize that the atrial infiltration is present in many patients with cardiac AL or ATTR amyloidosis. And what happens with atrial infiltration is that there is stiffening of the atrial wall, and this is also associated in a good proportion of the patients with a reduction in the mechanical contraction of the atria, to the point that a proportion of patients in sinus rhythm, so 20% of the patients in sinus rhythm with TTR amyloidosis will have no atrial mechanical contraction. And that's a very interesting observation because, for example, we used to guide the need for anticoagulation based on the ECG, presence of atrial fibrillation in sinus rhythm. But maybe we really should go a step further and actually base our decision on the presence or absence of mechanical contraction. Because from a mechanical point of view, having a patient in atrial fibrillation or having a patient in sinus but with no mechanical contraction is actually exactly the same condition. And this is also reflected by the fact that patients with sinus rhythm but no mechanical contraction have got exactly the same prognosis of patients with atrial fibrillation, which is significantly worse than patients with sinus rhythm and mechanical contraction. So I believe that we really should make a shift of mind in the way we think about the atrial function and really shift from considering just the ECG to really looking at the mechanical contraction with atrial strain.